Hello, it's the 2nd of January 2025, so right at the start of a new year. And tomorrow I've got my 6-week checkup with my surgeon, so I've been preparing for that. And to be honest, it's a bit disappointing today because I've been making really good progress over those 6 weeks, putting a lot of effort into rehab and all of the exercises, some of which are up on my YouTube channel. And today, really, for the first time, I've felt as though I'm really going backwards. For no obvious reason, my knee is swollen up and it feels loose and different. Not particularly painful, but uncomfortable. And I've not had that before, except of course in the very early stages. So to get it right now, literally the day before seeing the surgeon, and hoping to get, big tick in the box, done well, it doesn't feel as though I've got to the stage where I'd like to have been, and indeed the stage that I was in only a few days ago. My watt bike here behind me, yesterday I had a good rehab session on of about 30 minutes on a decent resistance, and there were no problems. Today, by contrast, I could manage 2 minutes tops, and when my knee, or my operated leg, got to its highest point, there was a quite uncomfortable sensation, just short of a pain, but not nice, above the knee. And for most of the day, down the lateral side of the knee, there's been a sharp sensation as well. I think that's all part of the swelling. When my knee does swell up more than usual, and I keep icing it, it feels clunky. And the best way to describe that is you can almost feel the working bits in it, the tendons, the ligaments, the joints moving over each other. Oddly, and I was in the car for half an hour earlier today, still not really driving. I can drive, and I have driven, but I'm not supposed to until I've seen the surgeon tomorrow, so I've restricted it. But in the car, there's a really odd feeling. When you go over a bump, it feels as though the knee is just sort of click, 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 like that. It's very odd. Left leg doesn't do it, only the right leg. And I don't know whether that's going to go away as the swelling goes down and the joint sort of tightens up and everything settles into normality. I hope so, because it's a bit disconcerting. I'm sure it will. So it's been a very interesting 6 weeks. It's flown by. After the operation, you come out and you think this is going to be a long, hard slog. The days turn into a very simple routine of exercise, icing, exercise, more icing, drugs, very interrupted sleep. And that carries on really for quite a few weeks. I guess the exercise routine changed over time, partly because I was having external physio, and so I incorporated more of their exercises into my routine, which made it longer, which meant I couldn't do it every half hour, because each time I did it, it was an hour. And it was so intense, with a lot of closed kinetic exercises, as well as some open ones, resistance, weights, lunges, etc. That to do it more than really two, absolutely tops 3 times a day, was just too physically demanding and put too much strain on the knee. But nevertheless, still a couple of hours of hard physical rehab every day, which everyone said was really important, and I'm absolutely certain it is. I think I've made overall, despite today's little setback, exactly the sort of progress that I hoped for, and possibly a little bit more. I walk around fine, no limp at all. I just can't ignore the fact that I've still got this new knee, and it doesn't quite feel me yet. Sure it will, but I know people say it takes 6 months, a year, and I guess that's true. Still very early days, it's only a month and a half. But it is a tough 6 weeks, but it passes, and it goes by reasonably quickly. I came off all the really hard painkillers around about 3 weeks in, 4 weeks in. Still maintain a regime in the morning now of having 2 ibuprofen, just try and keep the swelling down, and just to not too much pain, but just take away some of the discomfort that you get. But I'm hoping to drop those shortly. Depends on what happens tomorrow, I suppose, with this. And the exercise routine will continue to be part of my daily life. For the last month, literally, I have completed on my Apple Watch the exercise ring, and I've moved and I've stood absolutely on my target, and I've been very diligent about that, and I'm sure I've felt the benefit of it. But sleep's difficult until the last few days, really, where I've dared to move back in with my wife, because before I'd have kept her awake all night. Things have started to settle down a bit now. You still wake up, still a little bit uncomfortable sometimes, trying to find the right position. Fortunately now I can get my leg completely straight, because I've worked hard at that. In the initial stages though, where they said, you mustn't sleep with your leg bent, because it will make it harder to achieve that full extension, and that then leads ultimately to improper walking and limp, etc. I managed to avoid all of that by being careful with the exercises and working hard at it, and now I can do it, so I can actually sleep on my side where it's more comfortable, and that gives me a better level of sleep. This has been the winter period, of course. The operation took place on November the 20th. It is now the 2nd of January. And I think on balance, that's probably not a bad time to do it, because the weather's been rubbish. So I've been inside most of the time anyway. I'm very fortunate. I have my own gym, got my bike here, I've got my other exercise equipment. So I have got somewhere to go to do rehab, and I go to St George's Park too, which I think I've shown on one of the videos. But it is nice to get out into the open air. I did try a walk earlier today, actually, down at a local lake, but it's been very cold overnight, and I'd gone about a couple of 100 metres, and the shady path, which is tarmac, was very icy, and I felt, even that I'd got a stick with me actually just for security, I felt very uncomfortable. So I abandoned ship and went back to the car, because I just didn't want to risk a fall. I didn't have that confidence yet to be on very insecure ground conditions. But I will come back, and I'll just make sure that I've got appropriate sticks when I'm in a situation like that, as far as possible. You'll notice that my face looks a bit different from before, and that's because I've got actinic keratosis, which is a kind of precancerous skin condition, for which I'm taking this chemotherapy treatment called Epidix, which is an ointment that you rub on. It's pretty powerful, hence looking a little scary. The grandkids weren't too sure over Christmas. Anyway, hopefully this will go shortly, and it will have done the trick, and it will have got rid of all the nasty, potentially cancerous cells. But that's not interfered with the rehab for the knee. It's just another reason for kind of closeting myself away over the winter and just getting on with it, so that come the spring and the resumption of activities like golf and cycling, etc., walking, I'm in a ideal position to do it. And talking about motorbikes, of course my channel is Honda Wanderlust, and primarily it's about motorcycle touring. This is a bit of a diversion, but I did manage the other day to get on the bike, not to go anywhere, but just literally just to get on it, to actually get my leg over the saddle. And it was on the dolly in the garage, so it wasn't really sort of full situation. I got on using the peg, and it was okay actually. I mean, it's a little awkward, and you've really got to work hard to get that stretch. And I didn't have the panniers on, which I've no doubt will make it more difficult. And I will, when this is settled down, I will go and try that obviously again soon. But I'm not really intending to go motorcycling in the next couple of months anyway, because of the weather, and I tend not to do it over the winter. So I'll let it take its time. But I wanted to at least give it a go, as well as running the engine up. So the bike's in fine fettle, and I'm hopefully getting there. Anyway, there we go. 6 weeks in, I thought I'd give you a quick update on what it's like. It's on track, I think, and it will be interesting to see what the surgeon says tomorrow. Scars healed really nicely. Stick bio oil on it twice a day, which means that it's remaining supple and it breaks up any of the potential adhesions underneath. And I'm pretty happy with that, but I'm not in the swimming pool yet to do hydrotherapy. When I had the staples out, they said it's another 4 weeks, I think, after that, which is next week. So that's another thing to look forward to get back into the swimming pool and do some different type of exercises. But wish you all the very best for 2025. If you've had a knee replacement operation, some of this may well be familiar to you if you're past my stage, or if you're before my stage or just about to have a knee operation. Hopefully it'll give you a little bit of an insight into what to expect over the first few weeks. And the two mantras which I was told: one, keep taking the meds, and two, do the exercises, are absolutely 100% true. Make sure you do them. I have, and so far it's worked for me. Thanks very much, and take care. Bye bye.